Should be
Okay.
about to go live.
All right, no more dog talk.
We'll see what happens.
It is.
It's live. Okay.
Good evening. My name is Valerie Habeff, and I'm delighted to welcome everyone this evening on behalf of Jewish Democratic Women's Salon, Atlanta. Just a few weeks ago, we witnessed in horror what happened in Texas when their electrical grid went out because the state had failed to institute proper backup systems. The direct consequence of this backup failure was that Texans were forced to get by without the essential services of electricity and water that we all take for granted. Everyone on this call gets that healthcare should also be viewed as an equivalently essential service, and yet too many of our citizens are being asked by our state to forego the healthcare benefits that so many of the rest of us take for granted. The problem, of course, is that we have a large portion of our elected officials who, just like in Texas, in the name of states' rights, are willing to forego putting in place the healthcare backup system that our Georgia citizens so desperately need. Tonight, we're going to learn how to change that. In the 8+ years since we started Jewish Democratic Women's Salon, we have all watched with admiration at the tremendous capacity for grassroots organizations to collectively change the trajectory of our state. What we know from grassroots work is that change comes from within, and that it's incumbent upon all of us to assure that our elected officials represent all of us, not just some of us. Meaningful democracy means that every citizen is a constituent of every elected official in our state. That's a foreign concept to too many of our elected officials, and we, as a women's group, are working hard to change that. It's no small coincidence that tonight's panel is comprised of 4 women, and it's a great beginning celebration of Women's History Month to get to share time with these important change makers. We are so grateful to our esteemed panel: Laura Colbert, the Executive Director of Georgians for a Healthy Future, State Representative Shelley Hutchinson, State Senator Dr. Michelle Au, and State Senator Sonia Halpern. We thank you not just for being here tonight with us, but for the service that you offer to all of us on a daily basis. You are role models to each of us. We know that you daily go to work on our behalf, and we are delighted for you to share with us tonight how we can advance your work on behalf of improving healthcare services for all Georgians. And with that, I'm going to turn tonight's program over to Abby Fuchsman, our JDWS Focus Area Chair for Healthcare. Abby.
Well, welcome everyone. And this should be a good, fun sometimes, but interesting and pointed conversations. I'm going to start by asking each one of you to give a brief 1-minute introduction about yourself, your constituents, your organization, and just a little bit of a roundup. So Laura Colbert, we're going to start with you, our returning champion and the Director of Georgians for a Healthy Future. She's a true champion of healthcare advocacy in Georgia. And Laura, take it away.
Thank you, Abby, and thank you all for having me this evening. As Abby said, I am the Executive Director at Georgians for a Healthy Future. We are a consumer health advocacy and policy organization, and what that means is we work to change laws and systems so that Georgians have access to affordable quality health care so that they can live healthy lives and live in healthy communities. We do a lot of work like this, doing outreach to different communities across the state. And we also work directly with our elected officials, just like the rest of this amazing panel this evening. So we're really pleased to be here and can't wait to dig into the healthcare conversation.
Excellent. Thanks, Laura. Our next up is Representative Sally Hutchinson, who represents the 107th District in Georgia, and just like myself, is a New Orleans native. Yay. We didn't have Mardi Gras, we had house floats instead. They were awesome.
Yes, we did.
They were absolutely awesome. Sally, take it away.
Thank you. I am Shelley Hutchinson, and I am from New Orleans. And I graduated undergrad from LSU, and as soon as I graduated LSU, I moved to Atlanta and I started working for DFACS, Fulton County DFACS at that. I was able to get a grant through DFACS to go back to school. So I got my master's degree in social work and went on to be a clinical social worker And now I have an outpatient practice for mental health. We serve from Gwinnett County and we go all the way northeast to almost South Carolina at this point. We just extended services to Stevens County and surrounding counties up there. My House District 107 is largely family homes. We don't have a ton of businesses or churches, really. We have a lot of subdivisions and schools, and I have a great involved district, and they are, I think I represent them pretty well. I'm married with 2 kids. We just got a new puppy. I did the whole COVID puppy thing too. And we have a St. Bernard mix who is 7 months old and just about 80 pounds. So we're having a blast with him. And that's me. And I go to the Capitol and I fight sometimes, it seems, for not, but this is the long game. So I'll continue to go.
Excellent. Yes, and you will. Senator Sonia Halpern represents the 39th District of Georgia. And I have to tell you something that was personal to me. The kids, your children in that commercial, when you mention them and then they're playing in the background and I was in love with them. I couldn't stand the political commercials at one point. I adored seeing your kids. They were just a great 2 little kids to see. They always made me smile. So how about you and your district?
Thank you. Well, I also am so delighted to be invited to join tonight's conversation. I have been the senator for the 39th district. I got elected on December 1st. So I got sworn in January 11th. This is my first term. And it's been really great and informative so far. My background is I come to Georgia by way of the Northeast. So I grew up really in the Northeast. I went to college in Massachusetts. I immediately went and got my MBA in Connecticut in an international MBA program. So I studied overseas and finished in Hartford. Lived and worked in Manhattan for 8 years. Did a number of things in sales and advertising, media sales. And then I came down to Atlanta. I've been now in Georgia for just about 23 years. The entire time I've been here in Georgia, I have lived in the 39th district. So I've lived in many different parts of the district. So I have a very strong understanding about the differences in different parts of the district, but also the similarities between it. So District 39 is all in Fulton County, and it runs north to south about 20 miles, 30 miles almost, from Buckhead through Midtown to the west side of Atlanta, southwest Atlanta, on down to parts of College Park, a good bit of East Point, a good bit of City of South Fulton, and a little bit of Union City. So it is one of, I think, the most diverse districts in the state. And I'm really excited to be down at the Capitol fighting every day. This has been a really interesting time to also enter into the General Assembly, given all of the kind of hot button issues that we're dealing with this particular session coming out of the last election cycle. So thank you for having me.
Oh, excellent. Thank you for coming. Representative Michelle Au. She represents the 48th District of Georgia. And I have to tell you, I met you would be 2 years ago at Healthcare Unscrambled. Joe Binns and I and you were having a conversation. I fell in love with you. Yeah, I thought you were just magnificent. You were educated in a way that was so wonderful to have in the House, in the Assembly. You brought a lot of expertise in what you know, and it was great that you wanted to move that into politics. So I couldn't be happier to have you here. Tell us about your district and about yourself.
Thank you so much, Abby. That's really nice of you to say that and to remember me, because I know we all meet a lot of people, and it's like sometimes I think about the before times, like the before COVID times, how we would go to these events like Healthcare Unscrambled or these big.
We'll have them again. We'll have them again.
We will. I know it's just around the corner, but it's just like, it feels like an earlier time, like a different era now.
Blur's Day.
Yeah, exactly. Blur's Day, it's going to happen. But again, I'm Senator Michelle Au, and I represent Georgia's 48th district. I don't usually enumerate all the cities, but it encompasses a wide swath of North Fulton and Gwinnett counties. I personally live in Johns Creek. I'm a physician anesthesiologist here in Metro Atlanta. I work at Emory St. Joseph's Hospital, and I also have a master's degree in public health. I am really honored to be part of this first year class with Senator Halpern, also with Senator Kim Jackson and Senator Nikki Merritt. I think that I'm not speaking about myself, but about my classmates, that they are an incredible group. And it's so inspiring to be working with them and to be roommates and hallmates with these incredible women. And I could not be more proud to work with these incredible new senators in our General Assembly. So I mentioned that I was a physician I still am a physician, and I have a master's degree in public health. And, owing in large part to these latter two professional interests, I ran for the state Senate because I realized, and this was before COVID, right? So this is just a bigger realization, like in the scheme of life, that so many of the factors that affect the health of a community are really so far beyond what I or any of my colleagues can affect at the bedside, because by the time the patients get to us, it's really too late to fix a lot of these things that made them sick in the first place, right? So it's these social determinants of health, and that's the phraseology that we use in the public health sphere. I remember when I used it during the campaign, like early on, my campaign team would always say, don't say social determinants of health. It's too jargony, like people don't know what that means. But I think the one good thing about COVID is that we all are speaking public health a little bit now, right? We've all picked up a little bit of public health lingo and we understand what these things mean. So these are the things that affect the health of large populations. And it really is, in fact, these larger social determinants like access to health insurance, social equity, economic opportunity, racial equity, education, all these types of things, just to name a few of them, that
Clean
really
water.
have the greatest effect on the community health overall. So that's why I ran for office, and that's why I'm here. And I'm looking forward to an interesting conversation about healthcare.
Absolutely. Absolutely. Well, it's great to have you here. So I'm going to do a quick intro. We're going to get into the questions. For as progressive as Atlanta may appear to be, access and delivery of quality healthcare to many Georgia citizens is unattainable. Georgia is one of 12 states that has not fully expanded Medicaid. Georgia also has one of the highest uninsured rates in the nation and lagging in most health outcomes. The state also has profound health inequities, with Black women more than 3 times as likely to die during and after pregnancy than white women, and Black infants twice as likely to die during their first year of life. The COVID pandemic has shined a light on the relationship between structural disadvantage, including systemic racism, health inequities, as well as the great divides in access to resources by race, income, geography, and of course, insurance coverage status. Before we start, I want to remind our panel that we are a partisan organization. There is the word Democrat in our name. So I would like for you guys to be free in your answers and don't hold back. Laura, we're starting with you. Yours is a big question to launch this evening's discussion, but it's important for everything else. It's building the pyramid. We're curious about the economic and systemic racial inequity that seems to be built into Georgia's healthcare delivery system. Here are the questions. Can you explain who qualifies for Medicaid? Why hasn't Georgia fully expanded Medicaid? And why do you think Governor Kemp chose to seek a waiver to partially expand Medicaid versus full expansion? And if those weren't enough questions, I'm going to top it off with, could you please explain what a waiver is to the audience so that we could all be on the same basic understanding of healthcare access and delivery in terms of Medicaid?
Absolutely. I will try to cover all of that briefly and in very understandable terms. So it will certainly be the most difficult thing I've done all day. So in Georgia, Medicaid is a really foundational health insurance program. I mean, it is across the country, but certainly in Georgia. To qualify for Medicaid in Georgia, you have to meet 2 criteria. One is either age or health status. So if you are a child, so that is age, or health status, a senior, people with disabilities, a person who is pregnant. Those are the health status qualifications. So if you meet one of those categories, you also then have to meet, or your family has to meet, an income eligibility. So you have to make less than a certain amount of money, and be in those categories in order to qualify for Medicaid. So, and the income limits change depending on whether you're a child, a person who's pregnant, a senior, a person with disabilities. And as a child, it's typically, it is most generous and most easy to qualify. And it is very hard to qualify if you are a low income parent or a person with a disability. People who don't qualify include adults who don't fit into any of those categories, even if they make zero amount of money. So if I lost my job tomorrow and I made no more money for the rest of the year, I still in that case could not qualify for Medicaid. I would have to go without health insurance coverage. So the ACA's Medicaid expansion was supposed to kind of solve that and help fill that gap for folks. So it would create a new category that was only based on income. So any adult who makes less than a certain amount of income could qualify for coverage. And that income level was just above the poverty line. In Georgia, this year, that income level would be about $17,000 for an individual for the year, or if you're a family of 4, an income of $36,500 for the year. So obviously, very low income levels. Now, so Medicaid expansion would kind of broaden the base of folks who would qualify for coverage. Georgia, as Abby said, is one of 8 states that has not opted to expand the Medicaid program to include that new category of folks. And that would cover about 500,000 Georgians who are kind of in that group of people. Now, when you ask about reasons why we haven't fully expanded, that's a little tricky. And GHF is a nonpartisan organization, so I'm going to stick to some nonpartisan answers, and I will let my fellow panelists fill in some of maybe the more partisan answers. The most common answer we get about why Georgia has not expanded Medicaid is around cost. And a Medicaid expansion would cost Georgia about $300 million annually. Now, I will remind folks that our state budget is about $22 billion each year. So this $300 million is only, it's a drop in the bucket. It's about 3% of our budget. And we could pretty easily cover that cost by doing something like increasing our tobacco tax. So it's not a real challenge. This is just the public facing reason that our elected Republican leaders have said that they don't think Medicaid expansion is a good idea. Now, I think I can cover questions 3 and 4 together. So Abby mentioned a waiver. Waivers are just essentially a permission slip or a plan. So it just means that the state wants to do something a little different from maybe the traditional Medicaid program. Governor Kemp put forward what is called a waiver plan, or as I said, you can just kind of substitute the word plan in there instead of waiver. So he put forward a plan in 2019, and it was approved last year in 2020 that would expand Medicaid coverage partially, so not all the way up to where the Affordable Care Act had put it, but slightly below that. So it would go up to the poverty line, but people could only qualify if they could prove they were working or going to school at least 80 hours a month, and if they could pay a premium. And what we've seen in other states that have done that is that those are real barriers to coverage, not because people don't have the $5 premium or they're not working, but because they can't get through the process, either because they're taking care of family or they don't have internet access, or they can't get the paperwork from their employer. So there's lots of reasons folks can't meet those requirements, and courts have struck them down as illegal anyway. So the governor's plan would cover only about 1/10 of the people who would be covered under a full Medicaid expansion. And so that's kind of what he put forward. Now, what I think the reason is that he put forward this plan is that I think this is an admission that Medicaid expansion is a smart move for the state, that it is cost effective, that it would be the morally right choice to do to open up access to coverage to more people, but that Governor Kemp and his fellow elected Republicans have not been able to figure out how they kind of get themselves out of the painted corner that they have put themselves in after 8 years of refusing to do a full Medicaid expansion. So yeah, I think that's where we're at today.
Yeah, and thank you, because, in order to kind of build up on all these other questions, I wanted everybody to have a real good basic understanding of what we're talking about, what we're comparing to, and what we're going to be offered in the future, hopefully. Shelley, we know your background is in social work, and thank you, Laura. We know your background is in social work and is part of what makes you passionate about mental health. Can you give us an update on the status of the 2021 budget in terms of resources and supports for those living with mental health and substance use challenges? And maybe if you could, if you have some time, because I know these are supposed to be quick, but maybe an update of HB 514, a little bit of that explanation, and other bills like it that may be up that we're not familiar with.
Thank you. I will just put a little bit of a partisan mental health spin on why we haven't expanded Medicaid. In your life, personally, it's hard to admit when you're wrong. So we would have to have a collective of all of these elderly men who have these storied careers and have been in charge for all of their lives to admit that they were wrong and that President Obama was right. And that is just not going to happen. As you know, we had to cut close to $1 billion from mental health and from last year. And our budget just came out of our rules committee today, so we may be voting on it tomorrow. They have not restored all of that money. They've restored some, but we were basically in a hole before. And to say that we had to cut from a place where we were already below and drowning, it's a situation that most people can't fathom. If you have a child or an adult or a spouse or anyone that you love in your life that has a severe mental health illness or diagnosis, it's very, very, very difficult to get resources. I have so many people who come to me who know that I'm in the field with these horrible stories, and the only thing I can say is, yeah, that's about right. We don't have the resources for our most severe cases, and those are the ones that disrupt lives, disrupt family lives, community lives, neighborhood lives. There was a family just today that someone was telling me about who had an autistic child who was 8. And she told, actually, this was the dean of the House, Calvin Smyrie, telling me the story that one of his constituents had an 8-year-old who was autistic. And she said that she didn't have any more tears to cry because she's cried so many. And her child's 8. And unfortunately, we have nothing to look forward to. I have nothing more to offer her. We talked about waivers before. There are waivers to help children with autism, but they're limited and there's a multi-year waiting list. So unfortunately, the mental health situation is not looking great in Georgia.
No.
Go ahead.
No, it's horrible. And I heard a story today that makes things in Georgia even worse. There's just quickly, there's I think 188 people in the state of Georgia that are in a situation where they're waiting for this 5-year waiver to be approved to allow them to stay in their home with full-time care because they don't have the capacity to be in a facility. They're not facility types,
Yeah.
right? They don't fit. And now they don't want to provide the money for them to be at home. And what do you do with your child when, your child is your life?
And the thing about facilities, even if you were a facility type, even if you needed long-term care in a facility, they don't exist anymore. We had them in the past, but at a national level and a state level, we've moved away from congregate care. So there's really we have 6 facilities in Georgia that are supposed to be long-term, but they're not keeping people any longer than 30 days.
No,
and that's not enough.
no. And we can thank Ronald Reagan for that. Michelle, Al, we're going to go to you on that line. And as a physician, can you give us your thoughts on the rollout of COVID vaccines in Georgia? We're especially concerned about racial inequities. What plans are being developed at the state and local levels to make the vaccine rollout more equitable and to ensure that those communities being disproportionately impacted are targeted for outreach, education, and vaccination?
Great question and very timely, obviously. So I have some thoughts, obviously, about the COVID vaccine rollout here in Georgia. As anyone who has been following the news at all has seen, Georgia's really at the bottom of the stack when it comes to US states in terms of our vaccine deployment. I think that more recently, our governor has often been citing supply as the bottleneck to why we haven't been vaccinating as many people as are demanding vaccines, but I don't think that's the whole story. So why don't we just step back a bit and talk about the 3 problems that relate to vaccine allocation in the state of Georgia as nationally. So the first bottleneck is obviously supply, right? Like we understand that this vaccine is new and that all the manufacturers, and that includes Moderna and Pfizer, which have been the 2 that have been allocated in this state. And now, Johnson & Johnson has entered the chat. So we're going to start seeing that really this week start to roll out. But that we have received less than the number of patients who are eligible to receive the vaccine. And we all understand that. And we are patiently waiting for our supplies to go up. Luckily, with the Biden administration coming in, we are seeing more investment towards Pfizer and Moderna to ramp up their vaccine production, and Johnson & Johnson is also starting to deliver more on that. And probably by the end of the month, we'll have a significant amount to defray that supply-demand gap. However, that's not the only problem, right? The second problem, which I think is more of Georgia's problem in this moment, is the matter of getting vaccines from the truck and the box and the bottle into patients, right? And this is the issue of vaccine delivery, not like delivery in trucks, but delivery into patients' arms. This, I think we need to deal with some more, right? I know that we are ramping up our vaccine efforts, and I think that the Department of Public Health has been doing a really valiant effort in the face of having a really under-resourced public health department over the past several decades, and having an understaffed public health department and just being really working under adverse circumstances. And let's not forget that aside from COVID, the Department of Public Health does everything else related to our public health, including mental health, including regular vaccines, including WIC, Women, Infant, and Children's feeding programs, all these things they're still doing, and they have this monumental task ahead of them of how to get vaccines into all Georgians. So we really need to start investing more into manpower, staffing, supplies, infrastructure, standing up these mass vaccination clinics, and getting the vaccines to a place where we can actually deliver them to patients. That, I think, especially knowing that we have more vaccines coming to the state, we need to start working on that now, right? We should have started working on it months ago, but we won't belabor the past and just start working from now. The third problem, in addition to these first 2, is that there is a significant portion of the population, and that includes people I know, that includes people I work with, like in the hospital, that are reluctant or apprehensive about receiving the vaccine, right? Because I've heard this, and I'm sure all of you have heard this also, that people are concerned that the vaccine is new. They feel that it was developed too rapidly, and they just have understandable apprehension about receiving something that feels, experimental. I've heard that word a couple times. And just they're not ready to get it, even if they are eligible. So I think that there is a huge task ahead of us in terms of public health communication, in terms of reassuring people, convincing them to get the vaccine, really being public, leaders especially being public about their vaccine experiences and conveying to them that this vaccine has been tested, it is safe, it has gone through every single checkpoint that every other vaccine has gone through to qualify for FDA approval. And that really the important thing now, we never want patients to feel like they're being rushed into a decision. However, time is of the essence, especially given that we do have these new viral variants in the mix now, that the most important thing now is to get as many people vaccinated as quickly as possible. And that's going to involve us being very imaginative also, aside from our communication skills, is that we can't just set up these clinics and be like, just go to CVS. They're all there. It's fine, because people don't have equal access, even if they are in these, what we feel are mass market locations, right? Because people don't have equal access to the internet. People don't have equal fluency with the ability to use the internet or use online portals to schedule the vaccines. I've heard that from a lot of seniors in particular. So I think it's incumbent on us to really be imaginative in how we are getting people to schedule these appointments. I've personally made my office available for seniors or really anyone in my district to call, and we will help them set up these vaccine appointments if they are unable to or they're having problems. I also think we need to start thinking about mobile vaccine units to get to these underserved populations and underserved areas, especially in rural Georgia, to really do mobile vaccine units and even go door to door if that's necessary, because the most important thing to protect everyone is to get as many people vaccinated as possible.
Absolutely. And on that note, Michelle, I have a question for you. So just for the audience, dual eligibility are people who are both on Medicaid and Medicare. And we know a lot about those people. We have probably out of all of the people in this country, except for maybe the rioters on the 6th, we have an incredible amount of information on those people, right? Because they're Medicare, they're Medicaid, we've got that. Is there a plan, something in the works where we take that information and maybe you have half the people making calls to them to see if they've had some sort of access to being able to get a vaccine, and if not, knowing, check, they should be one of the ones to go get it at home in
Yeah.
their homes. So
Great question. Yeah.
I'm just throwing that out there.
Yeah.
I just, we worry about the older population, and the older population who also happens to be very poor is a tough population to vaccinate.
Such a great question. And obviously between Medicare and Medicaid, these are two different sort of jurisdictions, not to use like legal terminology, but with Medicare, that's federally sort of regulated, whereas Medicaid is state regulated, which is sort of part of the problem, right? That's why there's so much variation in how Medicaid is allocated around the country, that you have sort of, not to paint with a broad brush, but bluer states which have much more generous and much more broad Medicaid availability and ease with which patients can access Medicaid. And states like ours, where it's very difficult to access Medicaid, and in fact, they're trying to make it more difficult with these work requirements, all these sort of onerous, like bureaucratic hurdles that people have to clear, because there's this sense, and this really goes back to the inception of Medicare and Medicaid and how these two sort of split off into these different entities, is that with Medicaid, because it is for people who are living in poverty and low income people, that there's this sense in some communities that, the only people that should get Medicaid are people who deserve it, right? And that just goes back to the essential philosophy of what healthcare should be and who should be able to access healthcare. Is healthcare a right, which I believe it is, and I'm sure many of my colleagues who are on this call believe it is, versus something that you need to earn or deserve. That is an essential difference, I think, between the Republican Party and the Democratic Party, and that's something we're going to be fighting for a long time. I think my hope is that over time that everyone understands that we all need healthcare, regardless of party. This is something that everyone is going to need access to at some point. So it's a sense of basic humanity, in the sense of understanding that everyone has these same needs, and how can we all get to the same place of building a healthier community for everyone.
Absolutely.
In terms of reaching out to everyone, that's a bigger question, but that's sort of what I was talking about in terms of being more imaginative and reaching people. Because I
Right.
think some of the people that we aren't reaching are people that we're not reaching out to, right? So, so I think that's a great point, and I think a lot of community health centers, specifically for people who have English as a second language, like in my community, are trying to do exactly that.
Something like that.
Yeah.
Okay, round two. Lauren, yep, you're up for round two. Here we go. The American Rescue Plan has moved to the Senate. No one is certain what will come out of reconciliation. Assuming there will be financial incentives for states that have not expanded Medicaid, can you explain how those financial incentives would impact Georgia?
Yes, I'd be happy to. So in the current American Rescue Plan, so the COVID relief bill that is running through Congress right now, there is a really exciting incentive in there. We anticipate it will be kept as the bill moves through the Senate as well. But essentially what that would do is it would increase Medicaid funding to states by 5% if they expand Medicaid. Now, the 5% feels like maybe not a lot, but it turns out that Georgia's Medicaid program is so big and covers so many people that would actually more than pay for the cost of our Medicaid expansion. In fact, it would pay for the cost of our Medicaid expansion somewhere between 6 and 9 times. So we would effectively be getting paid to expand Medicaid. And this is just the best deal that has maybe ever come down from the federal government. And our state leaders would really be looking a gift horse in the mouth if they pass up on this one.
Oh, absolutely. Absolutely. I have to apologize, and I made a faux pas. Sonia, you didn't get your question. I had them on twos and I was getting rid of the sheets as I was using them. And it was like, oh my goodness. So my deepest apologies. So, so Sonia, we're going back to your first question. Sonia, first of all, thank you for your leadership in stepping up to fill the big shoes that were left behind Nikema. What are your thoughts about economic impact of not fully expanding Medicaid in Georgia? Specifically, how has this decision impacted hospital closures, community health centers, and other resources for Georgia's most vulnerable at risk communities? And once again, my apologies. They were both on the same sheet and I thought I was done. I
No
thought I had this so well tracked.
I think that when we think about the decision to not expand Medicaid, we do need to think about it very broadly. We talk a lot about the number of people that would be impacted positively, which we need to do. And we don't necessarily think about the negative impacts on institutions. And so the question around rural hospitals and community health centers, it's a really important and urgent one because they are being negatively impacted because we don't have that expansion. Since 2013 here in Georgia, 12 hospitals have closed in the state, and I believe 9 of them have been in rural communities. 118 of Georgia's 159 counties are considered rural because they have populations of less than 50,000 people. Studies show very consistently that all of our rural hospitals are endangered financially at high risk for closure. And just in 2020, like at the end of 2020, two hospitals closed. One was Northridge Medical Center in Commerce, Georgia. That was a 90-bed hospital. And Southwest Georgia Regional Medical Center in Colport, that was a 25-bed critical access hospital that closed its doors after 70 years. Most of the hospitals that are closing in these rural communities are the only critical care facility in those communities. And so those are going away. What does that mean? That means it puts much more stress than on EMS services. It also means that oftentimes all of the other infrastructure kind of that supports around hospitals. You're certainly in rural communities, your hospitals have kind of the highest paying jobs and the highest kind of skilled workers. What do they do? You've got pharmacies that are impacted, medical supply companies that are impacted. So kind of the reverberation of a hospital closure is beyond just that people now have to travel very far to get medical services if they travel far to get them. And that's the other piece. I mean, this idea that, oh, well, you can just go 45 minutes away. It's just not realistic always that when you need well care, just your standard everyday care, that you're going to do that. So I think that the implications are great. Most of these hospitals are struggling because they treat so many patients, frankly, who don't have health insurance and don't have the money to pay the high care of healthcare. This is why that Medicaid expansion would help to close that gap and would provide not just the people who need the insurance but it would also help our hospitals. As a practical point, I would say that when the government is going to send you, when 90% of the dollars are going to be provided by the government, it only just makes sense for you to take that money to get more Georgians, right? Get more Georgians covered and be able to pay out more payment to the providers. There was a statistic, this might be a little old, but for every $1 that a state invests in Medicaid expansion, they receive $13.41 in federal funds. It is like outrageous that we do not expand. And I think we've known for a decade that this is what we need to do. But to Representative Hutchinson's point, you'd have to be willing to admit that the decision to not do it was the wrong decision. I do think that for the rural hospitals, I will say that the Medicaid expansion is not the only thing.
We'll see if she comes back.
It is a first step. So I want to also say, can you guys hear me? I'm back. I think I lost you for a second. Sorry. Expansion is not the only thing, but it is a great first step to keeping those hospitals bolstered up. I wanted to also just say that there's one other thing. States that have done the expansion have found, and this is also on the economics, they have found that it's lowered the eviction rates of people being able to be insured. It would lower the healthcare expenses for small firms. It would help people who are self-employed would then qualify for free or low-cost healthcare. So the kind of broader financial and economic implications really are bigger than just, I believe in the argument that healthcare is that basic human right and everybody should have it. But there is, for our Republican friends, an economic argument generally to make too around why it would be good business to expand.
Absolutely. We have 10 years of evidence in states that took it from day one, and what the wonderful things that have happened into their rural communities, the expansion that has happened in their rural communities, the economic expansion, not just the healthcare and everything else that we expected, but all of the other, when we talk about the social determinants of health, that is exactly what we're talking about. We're talking about people who can get a better job, get a better place to live, have better education, et cetera. It all falls into that. But we live in a state where out of 159 counties, 79 of them don't have an OBGYN.
I know, which is outrageous and it's
hard to stomach.
Imagine. Yeah.
Thank you, Sonia. Shelley, now you're up. We know that the full expansion on Medicaid in Georgia can lower the number of uninsured adults to be expected to improve access and delivery of healthcare services to those in need. how might we expect full expansion to also impact other areas of concern? We gave you a beautiful segue: improved education outcomes, job opportunities, reduced poverty, and even social determinants on health.
Yes, absolutely. Just going back to what Senator Halpern was saying, if you think about, I live in Gwinnett, I represent Gwinnett, and I think about the hospital. Our big hospital, it's now Northside, but it was Gwinnett Medical. We have the hospital, but if you think about all the businesses around the hospital, the medical centers, the small surgical centers, everything that supports the hospital. So in rural areas, or even not in rural areas, if the Gwinnett County Hospital shut down right now, that's not just the hospital and all of their employees, that's all the supporting businesses around them and their employees. So we're talking about thousands of people and families who are missing an income. If you're missing an income, then everything in your life becomes unpredictable. And I always think from the mental health perspective, and I know a lot of people know about Maslow's hierarchy of needs. I know my kids learned it in like PE or something like that. But if you don't have the first level of your needs met, and that's safety, security, housing, food, that kind of thing, then you really can't move any further. So if we have families or children in particular on that first level where they can't trust the safety and the security of their immediate environment, they are not going to do well in school. They're not going to, get fulfilling jobs because the jobs are gone. They're not going to progress and become their best selves. Not to try to quote Oprah, but they have to have their needs met. And if you don't even have your basic needs, then you really don't have the needs that kids usually want for, like name brand clothes or Xboxes or things like that. And it just compounds the problem. So we see the fact that we haven't expanded Medicaid in super high unemployment, not just because of COVID, but our schools are suffering because if you don't have a job, you can't pay taxes, you can't buy anything, and so we don't have sales tax either. It's just a ripple effect, and that ripple effect affects us in every aspect of our lives. I know if you think about one thing about COVID and not going anywhere, I haven't had a pedicure in a year. And that bothers me, not to the point where, I need to have a legislation about pedicures, but we can't get the things that we used to have. It's a new normal, but we have families who can't get food, can't get medical attention for the smallest things. And in the mental health area specifically, if you do have a child or an adult with a severe need, private insurance does not cover anything really as far as a long-term care. If I have a family, regardless of their income level, I encourage them to apply for Social Security because the Medicaid that comes with Social Security covers so much more. And when you're applying for the Social Security disability, I'm not an expert on the eligibility requirements, but it's different than, I think our Republican counterparts feel like everyone's on welfare. Medicaid is welfare. Everything is welfare. We're giving. And the truth is, welfare ended with Bill Clinton. In '95, there was legislation that passed. You cannot, the traditional welfare check that people keep referring to, there's a maximum 4-year lifetime limit. Nobody gets welfare checks. Nobody. I say that everywhere I go. Nobody gets welfare checks. Please stop using those terms. But it would, all of the benefits can't even be articulated here at this time. I mean, we just don't have enough time to talk about all of the benefits. Yes. But needless to say, if we can just do this, it would improve things on so many different levels.
Yep. I know I said it again, but I said it before, but I'll say it again, that we wouldn't be in this situation if Reagan hadn't made certain decisions he made way back when. But
this is true.
It's true. Sonia, you're back up again. Sonia, Black women in Georgia are 3 times more likely to die from pregnancy-related complications than white women. Georgia also has one of the highest maternal mortality rates in the nation. Georgia, and only this year, expanded postpartum care from 60 days to 6 months. The American Rescue Plan provides 12 months of postpartum coverage for mothers on Medicaid. Why is this important? And why is assuring the continuum of care for both child and mother vital?
It's a really good question. So Senator Al spoke at the very top about kind of the social determinants, right? And there is significant research. Am I frozen again?
No, you're good.
Okay, good. There is significant research that shows the connection, right, between race, gender, education, income, neighborhood, and its reflection on birth outcomes and pregnancy outcomes. And so African-American women are 53% higher to have preterm birth, for example, and higher percentage of low birth weight babies among all racial groups, higher percentage of infant mortality rates. And so the reality is that being able to have access to healthcare throughout your pregnancy and then postpartum is really meaningful for the overall outcome of the mother and the child. For babies in their first year, every month, well, first, let me back up. For pregnant women, right, at the beginning, every month, you're supposed to go on your prenatal baby, it can women have just 5 prenatal visits, just 5 total. I don't know why this is telling me my internet's unstable. I'm sorry. After you have the baby, every month of the baby's first year, you're supposed to have well checks every month. This provides for that so that people can make sure that that is happening and overall help prop up the health of the mother and the child. The 60-day coverage, 60 days postpartum is just short. I mean, like you're barely even kind of back feeling like yourself 60 days after you've had a baby. And so the 6 months is good, but the year is great because it really does cover that gap and allows both mother and child more opportunity to stay healthy and be healthy, right? I mean, what are the causes of infant death early? I mean, oftentimes it's, well, if you're already starting off with a low birth rate, you're more likely to already have complications as a baby. SIDS is something to worry about. I mean, there's a number of different things that if you can get the coverage and you can have somebody who's advising you and that you can go to and that you can talk to about what's happening with your baby's growth and development, and they can also make sure that it's tracking right, the outcomes are going to be better in the long term for that child.
And every mother and every baby has the right to survive. And,
Yes.
and when you don't have an OBGYN or a pediatrician in your area near you, and you don't have a car, and you have to figure out how you're going to get to that appointment, it may not happen in 60 days.
No, and then add no healthcare coverage on top of that, and it's for sure not going to happen because it's expensive and it's already a hassle.
And bottom line, they're citizens of the same state that we live in.
That's right.
So, Michelle, we are 1 year into this Blur's Day pandemic. Many people have suggested that the reason US mortality rates are so much worse than any other country is due to the lack of sufficient public health infrastructure, especially for our rural communities. Can you speak to the healthcare challenges rural physicians face, overall impacts of rural healthcare coverage in Georgia as well?
Thank you for that question. And I'm going to use this question to talk about public health investment, period, right? Not just for rural healthcare, where it's extremely important, but just overall, like how we digest our investment in public health. So I'm just going to frame this in an example. So I'm an anesthesiologist, right? So I often joke that no one ever notices when I do my job perfectly, right? Because the default presumption is that everything, when you're in the operating room and getting surgery, is going to go smoothly, right? That's the default. And usually that's right, everything does. And no matter what happens during the case, we usually do everything fine and no one's amazed when we wake up at the end, right? Usually people only start to pay attention in the OR and in regular life when something starts to go wrong, right? And I think that's the story of public health, that we don't notice it until something's going wrong. So the thing with public health is that public health is all about prevention, right? And that's not a flashy thing to talk about. It's not something you can point at, but public health is about prevention, preventing problems. Generally speaking, medical care, that the kind we think of when we go to the hospital, goes towards treating people who are sick, treating people after they become sick or injured. But public health does something completely different, right? Ideally, public health deals with entire populations in rural communities and urban communities all over. We deal with people while they're still healthy, right? And the goal is to keep these populations well. And so I think that some of the reason that public health overall is underappreciated is because under regular circumstances, when everything's going well, when we're not in a pandemic, when nothing's happening, is that patients who have been helped by public health policy and public health measures usually can't tell that they've benefited, right? Like, let's think of some public health measures that we benefit from every day. Like, we don't worry about our kids getting polio. I certainly am not worried about that personally, but that's public health. Every time we leave our house and we don't get sick from breathing the air we breathe outside, that's public health measures in action. We don't worry every time we drive a car that we're gonna get an accident because we bulk all the kids into our car seats. We don't worry about breathing cigarette smoke when we go into the Capitol because that's public health in action. All these things are things that take place preventatively, seamlessly, and invisibly, right? So back to public health funding, which is what I think you asked about, is that when things are going well, or when you're not thinking about the problems, is that it always feels like the money that we are investing or allocating in the budget, it always seems like it's paying for something that we don't really need, right? Like, why? It's like when you're healthy, like I am, and we pay all these high health insurance premiums, it always feels kind of like a waste. Like, why am I paying all this money for nothing, right? You don't think about it until you need it, right? So when it comes to public health measures and investing in our rural healthcare systems, right? Many of us don't live in these communities that are requiring this healthcare, and we don't see the harm that's being done by not having these safety nets in place in these communities. And we don't see or feel the necessity of having these preventative measures in place, right? But we only see it when problems start to happen. So we only need to look at our COVID numbers, as you've alluded to. Why is Georgia doing worse than so many states when it comes to vaccine rollout, when it comes to our hospitalization numbers, when it comes to really all of our public health numbers, including, as you were just talking about now, our maternal mortality? All these things come back to the same issue, is that we are not investing in our public health systems, right? So we look at the problems at the bottom line. We don't realize that these are upstream problems that we need to deal with. And all of this has to do with our societal desire and understanding that we need to invest upstream in our public health measures and investing in our rural healthcare systems, because people need preventative care so they don't need interventional care. And that's sort of my very long-winded answer to your question.
And that would have saved a lot more lives in Georgia if we had had a real good public health structure set up prior to that. So my last question goes to all of the panelists, and it's just a simple question, but a great question for us to be able to hear. What are the most important action steps that GDWS and our larger grassroots organization can take to support the work that you're doing, and bring it back into kind of our atmosphere, our bubble, and have us do the work on our end? So we would love to hear what you think where we should be to help what you're doing in the place that you are. So we can go back down the line. Laura, you want to start?
Sure. Well, if you aren't signed up to get updates about Medicaid expansion at coverga.org, please do that. But I'm guessing that the folks on this Zoom tonight are already in touch with their legislators. If you're not, please do. But if you are, maybe find somebody who doesn't know their legislator that's in your circle and introduce them. That's the best thing we can do as constituents, is to get to know our elected officials so we can talk to them about these important issues. So please do that for yourself, or do that for a friend or loved one.
Shelley?
I would echo that. But I also will say that with a warning that you can contact your representative, your senators, but when we get into the big bills, the ones that really matter, like the voter suppression bill that just passed through the House, and the heartbeat bill, those types of things, their minds are made up before they go in. And there's no amount of protest that's going to change their minds. I know I was devastated my first session, because we had some great speakers and great protesters, and but we did not win a thing. It's like nothing changes their mind. I've heard the phrase, Democrats have to fall in love, but Republicans just fall in line. And that is so true. The best way to support us, definitely keep in contact with your representatives, your senators, and that's a great idea to get your family and friends to contact them as well. But the next step would be to find great candidates to replace them and support those great candidates. I was on a call today with some of my colleagues, and we're still just at a loss on how to develop and support the great candidates that we have. Gerrymandering is going to be a big deal, and it's going to be a game changer. So we have to stay involved, keep in contact, and support each other. I think if women were in charge, the state would look so much different right now. So we need more women. We need more women, or at least smart, sensitive men. But
maybe in 2 years. So
I'm counting on it. I am counting on it. So we need more. We need good leadership. They still, we flipped the state blue for the presidency and for our senators, and it's only because of gerrymandering that they still have a trifecta in the House and the Senate and the governorship. So that's where we have to. That's where they focused, and that's where they got their head up. We have to do the same. We have to play checkers. We have to play chess and not checkers.
And Valerie, I think the gerrymandering may be even the next program up, I think, or I could be wrong. And if I'm wrong, then it's going to be soon. How's that? Sonia, what do you think?
Well, I definitely echo what you've just heard. I mean, it's hard, right? We are in the minority. We don't have the votes. They plow right through us on those votes, and they vote on party lines. I mean, it's just the truth. I would say you can, for me, but I'm brand new, so I'm going to say, you can help us also focus on some of the things that you think need to happen that we can change, or at least can try to change and influence, right? That are smaller things that start to make a difference and build and build and build and still change lives and make a difference. Oftentimes, I mean, for me, as I'm thinking, and for myself, equity, access, and opportunity, like that's everything for me. I look at everything from that lens. And so I'm not going to be able to stop the voting bills, but I can put forward some bills that actually increase equity, access, or opportunity for Georgians that will make a difference in the lives of people. So even just helping to support us in the initiatives or the bills that we're trying to craft that do that, helping to make sure that we know some of the things that are important to you so that we can start to try to shape them in a way and frame them in a way that we might be able to get some Republican buy-in in order to get them done. That's what I would say sitting in, but I will tell you I'm new. So like ask me when I get to where Representative Hutchinson is. This is my thought a month and a half in. I'm day 26 in the session.
I knew.
So,
We'll
But,
ask.
it's like, where can we make a difference and how do we focus in on that? Because if we, like, I know for me, if I have to focus just on all this stuff, I cannot stop. I will go crazy. So you can help us focus in on those things that we can change that may not be those big, huge hot button issues, but are actually still meaningful and would make a difference for everyday Georgians.
Absolutely. Absolutely. Thank you. That was great. And I'm sure we will be in touch to find out how we can help you. Michelle?
The last point to close this out. I often talk to medical students about issues that are not quite this, they're not legislative issues, but they're similar in the scope of what we're trying to do and how people get frustrated. And what I tell people is don't let the frustration of the type of work we're trying to do make you cynical, right? Don't become that cynic, because I think what cynicism is and what it turns you into is it makes you think that nothing you do or try to do matters, right? And that is not the case, because I think we can see just over the past 2 and 4 and 6 years, how much has changed in this state, right? And these are not changes that we see in the immediacy. These are not changes we see in 2 weeks or 3 weeks or in 40 days in the course of one legislative session, right? These are changes that happen over time, but these are changes that happen much quicker than we think when we look at them in perspective. So what I would say is see the progress we have made. Don't become frustrated. Don't become cynical. And keep pushing, because we are going to get there, right? And we might not get there as quickly as we want. We may not win on every single issue or even most of the issues that we want to, but it's a game of inches, right? And we have to be patient and we have to keep doing the work, because that's how we've gotten as far as we have. And that's how we're going to keep going.
And-
So I really thank people for being on this call and not being cynical and realizing that this is part of the process. And we are just at the beginning, right? There's a lot more work to do and we're going to keep doing it. So
And it
thank
is
you for
amazing.
having these types of forums.
Absolutely. It's amazing when constituents do get directly involved. And Laura, I'm going to bring you into this for a second. When there were comments for the waivers that were being asked to written and placed in so that they could send them in the package. And they put this particular waiver, they went from being approved to pending. And we're not going to go into the politics of it because we could have 10 nights on healthcare, but it was the comments that Laura's going to explain that was actually part of their decision. So to pull it, so.
Yeah, I mean, so
It's important.
when you have a healthcare waiver, and I think this relates to a lot of policies, there's a really tedious process you have to go through, and there's like a public comment period. And so we understood that the public comments could really help lay the groundwork for future opportunities around Medicaid expansion for Georgia. So while we didn't win the first round, the governor's waiver got approved. We knew that once a more receptive presidential administration was in place, that those comments would give them the evidence and the firepower they needed to roll back a more detrimental policy and help to encourage the state to adopt a more progressive, a more equitable, a smarter policy. And so having those little small wins all along the way, that really can keep you from becoming that cynic. And they're really important. I mean, public comments feel so meaningless sometimes, but now that might be the thing that helps get us expansion in the state. And I think that applies to a lot of the fights about policy fights that we're having in Georgia.
That's real. It's important to remember. Valerie, I assume we're not taking questions, and I'm
afraid we're out of time for questions.
okay. So I'm going to close out. I tried. I think I did better than I actually even thought I was going to do. But so here we go. Access, quality, and delivery of care doesn't have to be Georgia's shortcoming. In my opinion, we must fully expand Medicaid. We can fully expand Medicaid, and so we should fully expand Medicaid. We at the Georgia Democratic Women's Salon want to thank you for our fabulous, and I love saying this, all women panel, because I think it's just so great that we have this all women panel tonight. I want to thank you for your time that you've spent with us, providing all the information for this evening. And as we at JDWS says, thank you for being able to educate, engage, empower all of us to be better healthcare advocates. And so with that, I would like to thank all of you guys. You were awesome. You know, I'm a hugger. And so it's kind of really a drag that I can't hug everybody goodbye and say thank you. But you guys were wonderful and fabulous. And I'm hoping that we have more healthcare events. I know we have this big cloud over us called voting rights. And people are really paying attention to that, but they kind of like that so they can do other stuff under the table. And we just also need to make sure that we're up to date on all of our healthcare advances, both nationally, what's coming down the pike to the state, and what's happening in the state as well. So thank you all for participating. Valerie, do you want anything, or you're
I
good?
think that does it. Thank you again for making complex material understandable. And you can see from the comments just in the chat how appreciative our audience is. And I know they feel that way, those that are watching live as well. Bye, everyone. Thank you.
Thank you.